The Social Services Division is made up of 3 programs. The Social Services area itself is based on crew referrals.
So basically we visit with people who have had 911 calls, and we visit them typically in their home, and we try to have a conversation that would either encourage a healthy lifestyle or make a change to lead to living safer.
Then the second area that we work with is a home safety education program. That also relies heavily on crew referrals. If a crew goes out on a fall or a lift assist, then they'll notify the HSE area, and then crews go out made up of volunteers. They'll chat with the resident about ways to reduce falls, but they also can install grab bars and smoke alarms. The third area is the grief support area, also entirely manned by volunteers. If there's a natural death in the city of Mesa, then grief support volunteer is called out. They go out and sit with the resident and get them through those first couple passes of what they need to do when a loved one dies. We had to completely change the way that we communicate with residents and the way that we provide them resources. So now, instead of going out and visiting the resident face-to-face, what we do is we've been calling them on the phone.
So we talked about the hand washing, cleaning and disinfecting like surfaces in the home, that sort of thing. So that was like the first part of our script. And the next part was talking about like what barriers they might be having specific to the pandemic. We knew that a lot of our older adults were nervous about going to the grocery stores and potentially exposing themselves. So we talked a lot about like specific grocery store hours for like the older adults. And we also talked a lot about the City of Mesa Adopt a Grandparent program that came out of the pandemic.
So now what we do is we chat with them on the phone about whatever instance it was that got the referral sent to us. We still provide them with the same resources. We try to email them or mail them through the mail the resource that we would have otherwise provided for them.
And Nan, you called here just to check on me. I'm okay. I don't have the virus yet that I know of, and so far so good. Thank you for calling and checking on me. Bye.
Luckily, at least the experience that I've had, and hopefully I'm pretty sure we saw this kind of through all the calls, you saw a lot more family and friends stepping in than you normally would have.
People were very appreciative to get the call. There were definitely instances where people were fearful. As we all know, there was a lot of scams going during that time, so people were fearful of talking over the phone with someone, like how do you know who I am, that sort of thing.
What is missing is that face-to-face, one-on-one contact with the resident. That's a huge part of what we do.
We have a lot more credibility when we're there in our uniform with a Mesa vehicle. It definitely gives us kind of a leg up in earning the trust of the resident.
And having that face-to-face contact with the resident is crucial in us being able to see what really is their need. Because you can tell me over the phone that my need might be, gee, I need food resources. But if I get to your home, maybe I'm seeing that you can't really care for yourself as much as maybe you should be able to. And maybe we could provide you resources for those types of services.
Specific to the pandemic, I think that a lot of what we have been providing through our outreach is compassion. I think a lot of our residents and people that we've been speaking to are just very, very just scared. And by having a phone call with them, even if it's just a 5-minute chat, I think really highlights compassion.
So it's that one-on-one, face-to-face contact that we can make that kind of carries a little bit further the services that the firefighters are providing.
We are looking forward to the opportunity to be back in the field to empower our residents to live healthier and safe lifestyles.